Hi everyone, you are listening to Dr. Prabhu, a consultant pediatric urologist at Hyderabad. Today we are going to deal with a very complex problem in children, which is bedwetting. Bedwetting is not only annoying for the child, it is annoying for the parents too. So today we are going to decipher the entire bedwetting in 5 parts, which includes what is bedwetting, what are the causes of bedwetting, when should a bedwetting be treated, how exactly the bedwetting is treated, and finally, when should you come and visit a specialist like pediatric urologist. So with this, we would try and understand the entire concept of bedwetting. Stay tuned for the same. Thank you.
Doctor, what exactly is bedwetting?
Bedwetting, also called enuresis, is when a child passes urine in their sleep at night. It's not their fault, and they're not being lazy. The condition is very common, affecting about 5 to 10% of children under 10, and in a few cases, it can continue into adulthood. It occurs equally across all cultures and social groups, though boys are affected more often than girls, and it can sometimes be inherited.
Doctor, what are the main causes of bedwetting in children?
Research shows that bedwetting usually happens for 3 main reasons. First, some children sleep so deeply that they don't wake up when their bladder signals them. Second, their kidneys may produce too much urine at night because they don't release enough of a hormone called vasopressin. And third, their bladder might be too small or overactive, squeezing too easily. Apart from these, bedwetting can sometimes be triggered by urinary tract infections, stress, anxiety, or even constipation.
Doctor, when should bedwetting actually be treated?
Enuresis often goes away on its own, but it can take many years. As a child grows older, chances of bedwetting stopping naturally increase. However, if a child is 6 years or older and feels upset or distressed by the problem, then it's time to offer active treatment, preferably by a specialist like pediatric urologist.
Doctor, how do we treat enuresis or bedwetting?
Treatment begins with visiting a pediatric urology specialist, and treatment depends on the child's situation. If a child has both bedwetting and daytime incontinence, we first treat the daytime problems. An enuresis alarm and the medications are the mainstay of treatment. The alarm sounds help the child wake up before wetting. A cure is often defined as 14 dry nights in 3 to 5 months. On the other hand, medications help to reduce urine production at night. It works in 70% of children when treated for 3 months, but alarm therapy needs to be continued along with medications. Alongside these treatments, maintaining a healthy lifestyle with regular toilet habits, good fluid intake, and avoiding constipation is very important.
Doctor, where can parents get help for bedwetting?
Around 75% of children with bedwetting become dry using the usual treatment methods. But if the problem continues, it's best to seek help from a pediatric urologist who can offer more advanced therapies after evaluating the exact cause of bedwetting. The good news is that with the right treatment, almost every child with enuresis can eventually become dry.